Welcome back to TV5 News at 9. Joining us this morning is Dr. Jagannathan, board-certified neurosurgeon and president of Jagannathan Neurosurgery. Thank you so much for being here today, doctor.
Morning, Colette. Thanks for having me again.
Good morning. We're delighted to have you. So today we're talking about a hot topic. More and more people have to consider disc replacement, and we hear a lot about motion preservation with this. Can you explain what that means for patients, doctor?
Sure. Well, one of the most common questions they get asked about surgery is about necessity for a fusion. And what a fusion is, when it pertains to the spine, is that you immobilize a segment of the spine to prevent abnormal movement. And a lot of times that is necessary in certain cases where abnormal movement can be related to pain. Yeah. But because of the major concern with fusion is that you lose some of a patient's range of motion. And recently, in the last 10 to 15 years, disc replacement, artificial discs, have become increasingly popular for that reason. And unlike a fusion in a disc replacement, the artificial disc is a mobile device that allows the neck or the back motion to stay intact, while at the same time, hopefully accomplishing the same decompression or relieving pressure around the nerves that would be done ordinarily.
Yeah, so tell us a little bit about disc replacement and what conditions can disc replacement be used for, doctor?
So disc replacement, because it's a relatively new technique, the window of conditions are fairly narrow. I mean, traditionally it's degenerative or arthritic disease, where you have a disc that's pushing on a nerve and the disc is abnormal, but otherwise the movement of the spine is okay. Yeah. So a patient who has, for example, an extruded disc in the neck, where it's pinching on a nerve and where otherwise the mobility of the neck is pretty good, a disc replacement is an extremely good option because it maintains the neck motion intact. It also, at least in theory, reduces the risk of arthritis developing above or below where we did the surgery, yeah. Which is a common concern with respect to fusions. But I think the caveat is it's a newer technique. Unlike fusions that have been around for 50 or 60 years, disc replacement has only been FDA approved for 2 levels in the last 5 or 6 years. So the long-term outcomes are still pending, are still in the process of being observed. But certainly, especially in younger patients where you've got to worry about mobility motion for a lifetime, right. It is a good option to consider.
Definitely want to preserve your motion. Thank you for that. Doctor, now, after patients undergo this procedure, how is recovery from cervical disc replacement?
Typically, it's an overnight hospital stay. The most common thing that patients like about it is that a collar is not required, and that's commonly required after multi-level fusions. Basically, patients are usually up and moving even the same day of surgery. There are some temporary restrictions when it comes to lifting and bending, usually during the perioperative period for about 2 to 3 months. But the goal is usually getting patients up and active as quickly as feasible.
Okay, Dr. J, if people are saying out there, I need to get some more information from Dr. Jagannathan, where can they go?
They can visit our website, www.mi-neurosurgery.com, or they're free to contact our office at 989-701-2538.
Thank you again for joining us today, Doctor. We appreciate it.
Thank you, Colette.
Of course, you're welcome. For more information, go to the hot link section at WNEM.com.